My name's Nikhil. I'm an ex-cancer patient, current medical student, medical researcher, and I've also founded this not-for-profit, Get to Sleep Easy. Recently, I was diagnosed with this lung condition that will probably, at some point, take my life. Something that could have helped me though, something I just found out about recently, something that was so simple, yet hugely effective, was this amazing little thing. A wedge pillow. I mean, sometimes it's hard to explain to people who don't have something like me, but some nights breathing can just be so damn annoying. Getting a breath in will be waking me up every single time, but other nights I'll be feeling like I'm suffocating. This is me on 60% lung function. I have friends on 30. Getting a higher angle under my back though, that allows my lungs to expand more. And it also reduces the angle to your stomach so that acid can't come back up, helping people with reflux too. That's why the wedge pillow in its current state is being given out by foundations around the world. However, on some days, I just need a bit more slant than other days. The wedge pillow is kind of limited. So that's why I went out and I took out provisional patents on this wedge pillow that can do just that. It can adjust to the angle you want. Not just because this can help millions of people with conditions like cystic fibrosis, asthma, reflux, and things like heart failure too, but also because I saw this amazing opportunity there. This wedge pillow, if you attach it to a mattress, it can do the exact same thing those $2,000 to $5,000 hospital beds do for 1/10 of the price. Speaking of hospital beds, my stays in hospital highlighted some other issues that could also be improved upon too. Which is why I went out and took provisionals on a bed frame using human-centered design principles. And the health benefits that come out of this not only help us in the developed world, but also help people in resource-poor settings as well. Reducing the burden of unnecessary hospital stay, disease, and death where it's needed most. So let me take you through that. The bed frame, not only can it lift at the head, but it can also incline or decline at the legs too. And if you think about it, when you incline at the head and decline at the legs, you've got yourself a chair. This encourages patients to sit up, reducing the rate and severity of pneumonias. It also helps patients when they're getting up out of bed. Now this and additional features will also reduce the risk of falls in patients. 85% of falls in hospital occur within the hospital room, and as many as 10% of people over 65 will have a severe fall. Our bed can also contour around a patient's body and massage them at key points. Now these are features that not just add comfort, but they also make hospital safer for patients too. Now we're partnering with Engineers Without Borders, not just to get this out to the whole world, but also because we're a social enterprise. We aim to give 100% of our profits to charity. We'll also be having a brainstorming workshop coming up soon too. Get in contact, we'd love to hear from you. And we'd love to have you on this journey.